Right now, 20% of older people in the community and 40% of those in care homes will have depression. However, many go undiagnosed and many more untreated. But young or old, with the right interventions, you can reduce the risk factors that lead to depression, and it can be treated.
After I lost John, cooking for one seemed pointless. The garden got overgrown. I didn't hoover, sometimes didn't wash. I'd be in bed a lot. I couldn't sleep though, I'd just worry. I didn't read. Even the TV and radio was too much at times.
Depression can present in many ways, not just feeling low. This means older people may not realise they are depressed. They may experience loss of interest in life, tiredness, low appetite, constipation, pain or poor sleep. Older people can feel worried, become confused and forgetful. They can lose confidence or feel like a burden. In severe cases, they may think about ending their life.
I like to be active, but stopped because of arthritis. I didn't go out. Some days I didn't speak to anyone. Most of my friends have passed now, and I didn't like to bother my daughter.
Loneliness, bereavement, long-term illness, being in care and hospitalisation are risk factors for developing depression. Having a history of mental health problems like dementia can play a role, as can excessive drinking and fuel poverty. This means that depression in later life is common, but it isn't inevitable.
I had a fall and needed a hip operation. I was in hospital after that. My physio said to get out of bed every day, but I didn't. I had a lot of pain. People came round, but I felt so guilty that somehow I was a bad person for causing trouble. They worried I wouldn't cope at home and would need 24-hour care.
Depression can increase the risk of developing other illnesses and can predict the quality of outcomes for hip fracture, strokes, and even heart attacks. It can be hard to spot in older people because the physical symptoms of depression may be put down to other long-term conditions. Older people may also worry about the stigma of having depression, so may not even seek help.
I barely recognised Mum when I visited. She seemed so withdrawn. I was really worried about her. And although she was asked about pain, her breathing and other things, no one asked her how she was feeling, how she was coping with everything. I tried to visit as much as I could, but with work and my own health problems, it was so hard.
It can be difficult for carers seeing their loved ones suffering with depression. Support for them is vital, as they are at risk of depression themselves.
Once it was recognised that Mum was depressed, she got help and so did I. She was started on medication and was referred for talking therapy to help with her grief, as well as coming to terms with her physical health problems. Mum got a social worker too, who arranged support to help her adjust to coming out of hospital. She was put in touch with a lunch club and other community activities, so she's not so isolated. It also meant I didn't worry so much about her being on her own. With the support of the team, Mum went back to her own home.
Yes, you're 80, but you still feel young inside. I still get bored or lonely sometimes. The biggest help was having something to look forward to in the week. I met some new people and got out the house more. Gradually, I began to feel like me again. Oh, I can see now that I was depressed. But there are things I can do to try and prevent it happening again.
If you are concerned that someone might be suffering depression, asking 2 simple questions can be the first step to a further assessment, diagnosis, and treatment. Please, don't ignore depression in older people. Reducing the risk factors can help prevent it. Depression in old age is not inevitable, and it can be treated. So ask the questions, start the conversation, see the person, not their age.